Hello, everybody. Welcome. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachowa, and I'm a physical therapist and owner of PAR5 Physical Therapy here in Randolph, New Jersey. And I've partnered with them to bring you an easy and educational workday session. So today's session is entitled Flexibility Fundamentals, Enhancing Range of Motion and Function. So we're going to talk about unlocking the benefits of flexibility training and improving mobility, reducing muscle tension, and preventing injury. We're going to cover the principles of flexibility training, stretching techniques, and strategies for improving flexibility safely and effectively. So a little bit about me. I received my doctorate in physical therapy from Mercy University back in 2010. And exercise physiology degree from Rutgers. That's probably 94. Wow. All right, long time. Anyway, I'm a board certified orthopedic clinical specialist, physical therapist, certified golf fitness instructor, certified level 1 CrossFit coach, certified dry needling specialist. And I'm here to help you out with your flexibility. So if you're here in class, make sure that you take advantage of that chat box or whatever it is, because I want to make sure that this session is as helpful and informative as possible. All right, so without further ado, let's kind of transition into my slides here. Perfect. All right, so flexibility fundamentals, enhancing range of motion and function. So let's turn on my little thing, and then, hey, first slide here. Life is about movement. Okay, we all know that movement is important, but not all movement. And movement, flexibility, your body, types of positions, it's like a vocabulary. All right, so you learn vocabulary from an early development age. Rolling, falling, and that type of work, we start to lose the ability to squat, lose our range of motion. All right, I am unmuted, hopefully. I don't know what happened, but we had a hiccup there. All right. So anyway, let's get everybody in here. There, I think the waiting room is getting full. There we go. So now we got people coming in. This is a live show, everybody. So this is what happens. So we're recording. Again, flexibility class. We talked about being able to move well, move often. Our movement is like a vocabulary. If we fail to practice that vocabulary in terms of the variety of positions that we put it in, we tend to lose them. So maintenance and moving around and stretching is very important. Just like any machine, you want to be able to maintain yourself, but then know when it is time to see a specialist. All right, so everyone should have that ability to do the things that they need to do to maintain their mobility, their flexibility. So here's my disclaimer. Because I'm a medical professional, I have to put this slide up that this is not physical therapy. This is general information that's aimed at a broad audience. So if you're dealing with something specific, make sure that you have a thorough physical exam and make sure that you address the root cause and all the associated factors if you're dealing with something. All right. Now, if you've been to my classes before, you've probably seen this video, this slide here, that the body functions on this alternating pattern of stability and mobility. If this pattern is disrupted, pain or injury is the result. So very, very important. If you take away anything from one of my classes, you got to remember this little alternating pattern, that stable and mobile segments are connected this way in this alternating pattern throughout our body, starting from the foot, The foot is a stable segment, and the ankle is a mobile segment. The knee is a stable segment. The hip is a mobile segment. The lower back is going to be a stable segment. So on and so forth, all the way up the chain. So if we understand this concept of this alternating stability and mobility pattern, then we could successfully treat issues that rise up. So say, for example, if you have back pain or knee pain, you can't really just focus on where that problem is. We want to be able to look at the segments above and below and make sure that they're functioning well. Because if the segments above and below aren't adhering to their role, let's just say, for example, the hip turns into a stable segment because you lose range of motion, you've got a tight hip, then what happens is that your body looks above and below and tries to gain that loss of range from those other parts, like makes your knee unstable or makes your lower back unstable. They'll turn those into a mobile segment. So that alternating pattern is important. So if you focus on one spot, sometimes the issue will come back again because we're not treating upstream and downstream from the problem. All right. So real quick about the types of stretches that we'll be. Joint mobilizations is one thing where we start the joint through a larger which we're talking about, but some of them are regular, like hinge joints, like the knee or the elbow, and then some are ball and socket joints, like the shoulder, the hip, and they need to be able to move and glide the way that they should. So we're going to go over a couple of joint mobilization exercises to improve range of motion in a joint. And then the types of stretches that we do for soft tissue, and that could be muscle, tendon, ligaments, but also fascia. And fascia is probably the most important soft tissue structure because fascia is this connective tissue, sweater-like spiderweb material that gives our body its shape. Muscle that doesn't have fascia is basically disorganized hamburger meat. So the lines of fascial tension in our body connect our lines of tension so that we can create motion. And we'll talk a little bit more about that. But dynamic stretches are basically movements that are large and we're not holding any one position. We're taking these tissues and joints through a full range of motion without pausing, just to warm up the tissue, get some extensibility and sliding through that tissue. And then static stretches are ones that you hold for a prescribed amount of time. Usually that's at least 30 seconds up to a minute to create this long extended hold, which changes the length and the tone of that muscle. Okay. The next one here, muscle tightness doesn't necessarily equal muscle shortness. A lot of times people will come to me and say, my hamstrings feel tight, or they're tight and they pull on my back. But the hamstrings are a group of muscles behind the leg. They start at your pelvic bone, your sit bone, and they go all the way down to the back of your knee. And a lot of times people will test their hamstring flexibility by reaching for their toes or whatever in standing. And they'll say, hey, I can't reach my toes. My hamstrings feel really, really tight. But again, tightness doesn't necessarily mean that it's short. The biggest determinant whether or not a muscle can lengthen is your nervous system. If your brain senses that, hey, I can't turn this muscle off sufficiently to allow it to stretch because I'm using it as a stability brace to hold myself up against gravity, for example, it's not going to turn off sufficiently for you to say, for example, bend over and touch your toes. So the neurological component of flexibility is key so that when we go into these stretches, we want to go easily and gently, especially these static prolonged stretches where we can use breathing, like an inhale and exhale through the nose only, 2 seconds in, 4 seconds exhale, that can calm down our level of threat and reduce that, that tension in the muscle, allow that muscle to turn off and relax and respond better to these stretches. Joint mobilizations, we're going to talk about that. I like doing joint mobilizations to thoracic spine, that's your mid-back, because that tends to be tight where the ribs connect into your spine. Let's see, shoulder mobilizations as well, because that tends to be tight, especially with a lot of the overhead athletes that I see. And we talked about dynamic stretches being something that we could do in terms of quickness. Static stretches are about like a 30 to 60 second hold. One thing though I would say is this, that in general, when do we do these stretches? So one thought is that when a muscle stretches, when you're stretching it for a static stretch, and that's when you hold it for 30 seconds, there is a period of time after that stretch that you reduce its ability to create tension or power. So you weaken the muscle in the process of getting it stretched out. So typically, we don't do static stretches right before some type of activity or sport, like a powerful move or your game or your lift. So we want to do dynamic stretches, movements that take the range of motion and enlarge it, but we're not holding that one position. So we build tissue extensibility or flexibility in the tissue, improve blood flow, and then lubricate the joints. So those are good generally prior to activity. But that being said, there's some studies that show that the effect on muscle strength is pretty negligible after a static stretch. So, your mileage may vary depending upon what you want to do. All right, so let's get rid of this slides here, this boring stuff. Let me figure out where my cursor is. And what I need to do is pull up my camera, which I'm missing right now. That's great. So hold on one second. This is, again, totally live. Here we are. All right, boom. There it is. There's my camera. All right, so the first thing that I want to do is go into what I mentioned before, a thoracic stretching. And I love using a foam roller. There's a lot of things that you could do with a foam roller, but the main thing is either soft tissue mobilization or joint mobilization. So this is what we're going to start with. You're going to take this foam roller, you're going to place it on the ground, and you're going to place it across your lower back, across your mid back. So my hips are going to be on the ground here, my knees are going to be bent, and I'm going to place this on my lower ribs. So from here, what I want to do is create an extension movement over the foam roll. Now, my hips and my knees are going to stay stable. My abdominals are going to stay tight because I want to stabilize everything that's on this side of the foam roll. And I want to move what's on the other side of the foam roll. So getting my shoulder blades out of the way, either I wrap my hands around my chest or put my hands here and bring my elbows forward. Super important because I want to create tension in the tissue, in the muscles in my upper back. And then I repeatedly just go back. And again, joint mobilizations they don't need to be held. They need to be repeated because we're trying to mobilize a joint. So we're taking that through as big a range of motion as possible. The big thing with this, and the one performance tip that we want to pay attention to, is how the lower back moves as we go back. As you go back, we got to keep the abdominals on so that your lumbar spine does not extend and come along with it. So again, everything on this side of the foam roller is going to be stable, locked down, and everything on the other side is going to be mobilized and trying to rock back. And there's 13 segments that you can go through the mid back, the thoracic spine. So we're going to take our time and go through each one of these. Usually, this type of mobilization, as you're going, you're kind of searching for spots that might be a little bit tight or limited. Then you're going to start to stick on those and try to work on them a little bit longer. But you take as much time as needed and as many reps as needed at each segment, however you need. Now, usually we see foam rollers go over soft tissue up and down. So for example, I could use my quad here. So for example, my thigh. We could take the edge of the foam roll and I lay down on the foam roll. Hopefully that's on the camera, right? I have my other knee off to the side. I'm supporting my body with my elbows here, and I can just go up and down. Now, as for trying to go up and down, the key is to create like a pressure gradient where we're taking this tissue, the deeper layers and the superficial layers, and smushing them together and trying to create shear over the deeper layers, right? So I can kind of roll around, and the quad muscle, the thigh muscle, also wraps around to the outside of my thigh. So I definitely want to be able to roll to the side slightly and get the lateral quadricep. It's a big muscle that covers the entire front part of my upper leg. And I want to go nice and slow and feel like I can roll forward and backward or up and down to create some type of pressure gradient and tissue change. Now, a lot of times people will get onto a foam roller and it will be uncomfortable, especially if you get onto a trigger point. The biggest thing that we want to do, again, is to reduce that sensation of that fight or flight response where everything tenses up and your nervous system goes on fire by taking that breath, all nasal breathing, 2 seconds in, 4 seconds out, right? And doing that repeatedly calms down your nervous system and turns off that muscle so you can mobilize it. And the same thing can be done for the hamstring, the back part of the leg. You can kind of do this up and down and then kind of get to the left, get to the right, and different sides. Now, another mobilization that I like to do, especially for my overhead athletes, is to work on this upper trap and also first rib. Okay, so the first rib is kind of like where your sternum meets your collarbone and it wraps around. And as your arm comes up, the collarbone needs to rotate up and back to give you full overhead range of motion. And also as it articulates to the shoulder blade, that needs to move as well. So one other thing that I do for a joint mobility exercise is to use some type of ball, trigger point ball, lacrosse ball, doesn't matter, tennis ball, and we place that on that upper trap. Right? So let me move this off to the side. I'm going to place that on my upper trap. I'm going to lie down on it. All right? So here it's pinned and my target is right next to my spine and on my upper trap muscle. And I don't want to be on my spine, but I want to be pretty close. And again, this might be another spot that might be tender. We want to do our nasal breathing, relax through here, and then take our arm through a range of motion that kind of mobilizes that joint. Shoulder joint, right? Bringing this up and back. I find that this will help relax that upper trap and mobilize that first and second rib so that that collarbone can rotate all the way back and free up that last couple degrees. If you're having issues with last couple degrees, 10 to 15 degrees of overhead full range of motion, then this is a good mobilization for that joint to do. These mobilizations, either it's a foam roller or a ball, I usually recommend at least 1.5 to 2 minutes of work through that. Okay, so let's talk about dynamic stretching. Dynamic stretching, we mentioned, is something that you've probably seen before where we take our range of motion and just make it nice and big. For example, for the shoulder, we can do arm circles. Arm circles are easy, taking it through a range of motion that's comfortable and going at a pace that feels good, right? We don't want to create a lot of tension through here. The big thing for the shoulder joint is that we want to open that joint as much as possible. So I like arm circles with the palm up, not palm down or definitely not thumb down as we go through. Palm up opens up the shoulder and we can go different directions, right? And if we go around counterclockwise and clockwise with both arms or forward, alternating sides, we get a little bit of rotation through our thoracic spine as well. We can do forwards, we can go backwards. If we go below in the lower body, we can do leg swings, holding on to a wall, bench, table, leg swings. I get like a dynamic stretch through my hamstring and hip flexor in the front and back. The big thing with this is as we start to do these dynamic stretches, we want to keep everything that's not supposed to move as stable as possible. I don't want my trunk to move as I do leg swings, and I don't want my head and my trunk to move when I do arm swings. So midline stability is key when we start to do these leg swings. And you've probably seen things that like you're doing butt kicks where we're kind of bringing the knee up, gets a little bit dynamic stretch through the quad, but also we can get through the hip and then alternate sides, bringing knees to the chest. So those are all dynamic stretches, taking your range of motion through a large range, or your joints through a large range of motion to improve flexibility, blood flow, and lubricate the joints. Now, static stretching is very classic, and I would say that you could probably do them in any position. Let's just say, for example, we talked about hamstring earlier. So in sitting, the muscle, the hamstring, connects to the sit bone and goes behind the knee. And we mentioned earlier, fascia. Fascia is this connective tissue that gives our body its shape, it gives our muscle its shapes, it connects segments to segments. So there is a fascial line, a posterior fascial line, that comes from the base of the head all the way down the spine, through your hip, and all the way down to your heel. So oftentimes we can get more stretch or feel tighter depending upon how the ankle is situated. Ankle up as I bend forward, or ankle pointed and bending forward. The other thing is where the muscle is connected, we want to make that as stable as possible. If we go into a static stretch and one end, just like with the rubber band, if we're not stable at both ends, if I pull one and the other one isn't stable, everything will just kind of move, and then we'll lose the efficiency or the effectiveness of that stretch. So for the hamstring in particular, because it's attached to my pelvis, I don't want my pelvis to move. So the big thing for this position is to avoid rounding the back as I go down. Now, depending upon your flexibility, your knee doesn't need to be 100% straight. Okay, you can get an effective stretch into the muscle belly of the hamstring by giving it a partial bend. That's cool. But what's key is that your pelvis remains locked in what we call an anterior tilt. My back is straighter, it's not rounded. That sets my pelvic line. And then I tilt forward without moving my spine. I'm not rounding my back. And then I start to get that stretch right along my back of the hamstring. If you're more flexible, you want to lock out the hamstring, pull the toes up, keep your chest up and your back straight, and you go forward. That's a much more intense stretch. But whatever it is, you want to pick a position that feels comfortable for you, of what you can do, what makes sense, what's comfortable, and one that you can relax in for at least 30 seconds. And you could use that breathing pattern that we talked about earlier to kind of turn all that off. Okay? So hamstrings are easy. Calves are very, very important too, because a lot of times people who have tight ankles or tight calves tend to have issues with squatting and knee pain. So I had a client the other week tell me that they would stretch their calves off of a step, and they would just kind of, I'm going to use my treadmill here, and then kind of go like this and drop the heel, and then feel the stretch in the calf. Again, the big thing here is try and protect the beginning and end, or the origin insertion of that tendon, and also not create undue stress on other joints. When we're doing a calf stretch off of a step where the heel is unsupported, what happens is that we promote what we call pronation in the midfoot, and that can create to flat feet. So we want to avoid making your foot unstable, right? Because remember that pattern that we talked about, and not making it a mobile segment where we collapse and go into pronation. So I always tell people to get your calf stretched, let me do it on this leg, with your foot and heel supported on the ground. Prop up the front part of your foot under the ball of your foot with something. I have a half foam roll here. You can use a textbook, you can use a brick, doesn't matter. But the main thing is that the heel has to be on the ground. Now there are two muscles in the lower leg. You stretch one with the knee straight as I bring my hip forward, and then you stretch the other with a partial bent knee and bringing your hip forward. The key with these two positions is that the foot needs to be totally straight. It cannot be turned out as you're going to the stretch. Again, to promote proper joint alignment and not creating an unstable foot position. All right. And then the quad stretches, hip flexors are typically tight on a lot of people who sit throughout the day. So I love doing a hip flexor stretch to open up the hip. You can do this in seated. Drop yourself off to the side, bring this leg back. And then again, hip flexors, part of the hip flexor starts on your lower back, so it can contribute to back pain. And it ends on the front part of your leg. So these 2 points, these two joints, your lower back and your hip joint, need to be stable. So how do we do that? We got to contract or flex your glute muscle, which takes our pelvis into a posterior tilt, and then abdominals stay on, and then you kind of bring your hip forward, and then that'll give you that stretch here. 30-second hold for all these static stretches. Another version is the half kneeling version where my knee is down, but the rules stay the same. Contract the glute muscle, contract the abdominals. That's the origin and insertion of this muscle group. We're going to keep those on and then bring our hip forward. If we're not stable with these stretches, a lot of times we just kind of like unlock the hip, unlock the back, and then we can just kind of go back, go forward as far as you can. Then we start to search for that stretch, and that pulls a lot of other muscles in and creates more strain on your back. So again, the key point is whatever stretch that you're trying to do or whatever muscle you're trying to stretch, we want to make sure that both ends of that muscle are stable as possible. All right, so we went over that. Let's see here, pec stretches. I think shoulder stretches, this pec tends to be a little bit tight as well because we're all rounded. So that rounded posture we can address with that foam roll that we started. But opening the front part of your chest, all this tight spot, taking that arm back is one I think is also as useful as possible. You can do that single-armed. I'm going to step up here so I can hold onto the wall. I'm just going to put my hand on the wall slightly higher than my shoulder, and then I'm going to turn away. My fingertips are facing backwards. And as I open up my chest here, I'm turning my chest the opposite way of the direction that my fingers are pointing. And I should feel a big stretch through the front part of my chest, bicep, elbow, maybe into the wrist, depending upon how tight I am along that fascial line. And again, 30-second hold would be good. You can also do this with both hands on the wall if you're in a corner or doorway. It's another version of that, but I'm just showing you the single arm version just because that's all I got physically right here. Alrighty, so let's see. I hope that was helpful. We went through a lot of stuff in a very short amount of time. Let me know if you guys have any questions, right? If anything that you wanted to come, go over, or some of this didn't make any sense to you. All right, so if there's no questions, I'm going to close it up. Give my 30-second countdown with the questions. We're going to close it out. All right, you're welcome. All right, everybody. Thank you for joining me today. You can look for this session and many more on demand in any of the Better Spaces apps. I'll be back in October, Tuesday, October 8th, where my class is going to be Understanding Sciatica, Causes and Treatment Options. Now, sciatica is something common I see all the time. It's when pain radiates down the sciatic nerve, often due to a herniated disc or spinal stenosis or some type of nerve impingement. The session is going to talk about the causes of sciatica. Is it true sciatica? And we could differentiate if it's sciatica from other types of back issues and treatment options such as physical therapy and stretching, similar to what we did today. You'll learn how to manage and prevent sciatica episodes with core strengthening and posture adjustments and exercises. So that's all October 8th, Tuesday, 1 p.m. All right. In the meantime, if you have any questions, you can email me here at paul@par5pt.com or team@betterspaces.com. All right. Thank you. Be well. And thanks for coming. Bye-bye.